All right, this is it. Welcome to the final explainer in our top 200 drug series. You have made it all the way to tier 4, the last 50 drugs. I mean, you've already crushed tiers 1, 2, and 3, so you've got the core stuff down. Now we're just going to complete the picture and get you that full top 200 mastery. Let's do this. Look, this is what it's all about. This tier, it's that final layer of polish. It's what takes you from being a good technician to a great one. Super confident and ready for anything, not just the exam, but for what you'll see every day in the pharmacy. You've come so far. This is the final push. Let's finish this journey together. So to make these last 50 a little easier to digest, we've broken them down into 5 sections. We'll hit pain and muscle meds, then CNS stuff, some key heart drugs, hormones and antibiotics, and then we'll wrap up with the rest. Sound good? Okay, section 1. Pain, inflammation, and muscle. First up, we're diving into drugs that handle pain, chill out muscle spasms, and calm down inflammation. You're definitely going to see these. All right, let's fire them off. We've got baclofen, brand name Leorisol. That's a muscle relaxant for spasticity. Then there's methocarbamol, which you'll know as Robaxin, another one for muscle spasms. And finally, the lidocaine patch, brand name Lidoderm. It's a local anesthetic, perfect for nerve pain. Next up, a whole group of anti-inflammatories, and these are all corticosteroids. You've got triamcinolone or Kenalog and prednisolone, brand Orapred. Then we have a couple of topical ones for the skin, betamethone, which is Diproline, and flucosone propanoate, brand name Qdivate. And here's your pro tip, right? If you see a drug ending in sone or olone, you should immediately be thinking corticosteroid. That's a huge clue. Okay, to wrap up this section, we've got 2 really important drugs. First, methadone, brand Dolafine. It's an opioid used for both pain and helping with opioid dependence. But here's the key thing you have to remember. It is a C2, a Schedule II controlled substance. That is absolutely going to be on your radar for the exam. Then we have colchicine, or Colchris, which is the go-to for stopping a painful gout attack in its tracks. All right, moving on to section 2, CNS and neurology agents. This is where we get into medications for the brain. Think seizures, sleep, migraines, all that good stuff. So, 3 anticonvulsants up first. Gabapentin and acarbol, brand name Horizont. This one's for restless leg syndrome, or RLS. Zonisamide, brand Zonegran, is your classic seizure med. And then we have lacosamide, or Vimpat, also for seizures. But hey, pay attention here. It's a Schedule V controlled substance. You really have to know your schedules. And just a quick reminder on why this is so important. These schedules from C2 to CV, they're all about the potential for abuse. So a C2, like methadone, has a high potential, while a C5, like Lacoside, has a very low potential. Getting this right isn't just about passing the test. It's about patient safety and following the law. It's fundamental. Okay, let's talk about sleep aids. First, you've got Isopiclone, or Lunesta, and Zaleplon, brand Sonata. Both are for insomnia, and both are Schedule IV controlled substances. And hey, a little memory trick for you. Both have that Z sound, right? Isopiclone, Z-Aloplon. Think Z-Ziz for sleep. Then there's Ramelteon, brand Rosarem. It also helps with insomnia, but it's not a controlled substance because it works on melatonin receptors, a totally different mechanism. Okay, to finish up the CNS section, first we have a couple of migraine busters. Rizatriptan, brand Maxalt, and Almotriptan, brand Axert. You can tell by the names, they're both triptans. Then we've got lithium, or Lithobid, which is a really important mood stabilizer for bipolar disorder. And last but not least, atomoxetine, brand Strattera. This one's an SNRI used for ADHD, and it's a non-stimulant, which is a key detail. All right, let's jump into section 3, cardiovascular drugs. We're talking about meds for high blood pressure and cholesterol here. I guarantee you will be seeing scripts for these every single day in the pharmacy. So first up, we've got a whole family of drugs called ARBs, which stands for angiotensin II receptor blockers. They're all for high blood pressure. We have telmisartan, brand name Micardis, olmesartan or Benicar, and candesartan, also known as Atacand. Now, are you starting to see a pattern with those names? Yes, look at that suffix. Telmisartan, olmesartan, candesartan, they all end in sartan. This is one of the best tricks you can learn for the PTCB. These suffixes are like cheat codes. When you see sartan on the exam, your brain should just scream ARB. That's a gimme point right there. Okay, now for combo pills. These are super common because, let's be real, it's easier for patients to take one pill instead of two or three. So we have triamterene with HCTZ, which is diazide, metoprolol with HCTZ, that's low pressor HCT, and HCTZ with losartan, known as Hyzar. And then Caduet is a really cool one. It's amlodipine and atorvastatin, so it tackles both high blood pressure and high cholesterol in one pill. Super efficient. To wrap up our cardio section, let's look for another pattern. We've got Gemfibrozil, brand Lopid, and Fenofibrate, brand Tricor. Do you see it? The fib right in the middle of their names. That's your clue that they're both fibrates, and they're used for high triglycerides. Then we have Nebivolol, or Bistolic, which is another beta blocker, and finally Renalazine, brand Renexa, which helps with chronic chest pain, or angina. Okay, on to section 4. This one's a bit of a mixed bag, but it's all important stuff. We're going to cover hormones, some newer diabetes meds, and a few more antibiotics. First up, hormones. We've got raloxifene, brand name Avista. It's in a class called SERMs, and it's used for osteoporosis. Then we have two super common birth control pills. You've got the combo of levonorgestrel and ethinyl estradiol, think Ales, and the combo of norethindrone and ethinyl estradiol, like an orthonovum. All right, for type 2 diabetes, it's time to flex those suffix spotting muscles again. First, there's canagliflozin, brand Invokana. But now, check out the next two, saxagliptin, brand Onglyza, and linagliptin, brand Tradjenta. See that? They both end in gliptin. That is your signal that they're DPP-4 inhibitors. Seriously, learning these patterns is a game changer for the exam. And for our antibiotics in this tier, we've got minocycline, brand Minocin, that's a tetracycline. Then we've got a pair of macrolides, erythromycin, E-mycin, and clarithromycin, bioxin. And there it is again, that thromycin ending tells you it's a macrolide. And for the last one, notice the detail, ofloxacin ophthalmic, brand Ocuflox. It's a fluoroquinolone, but it's specifically for the eyes as an eye drop. We are in the home stretch, people. Section 5, rounding out the list. This is the last batch of drugs that gets us to 200. We've got some respiratory meds, a couple of supplements, and some really common over-the-counter products that you just have to know. All right, let's power through this last list. For respiratory, 2 combo inhalers, budesonide and formoterol, which is Symbicort, and ipratropium with albuterol, that's Combivent. Then for supplements, we have ferrous sulfate, which is just iron, and cyanoqualamine, which is vitamin B12. And please, please do not forget about these over-the-counter meds. Loperamide, brand Imodium for diarrhea. Psyllium, Metamucil for constipation. And polyethylene glycol, Miralax, also for constipation. They will ask you about OTCs, I promise. And that's it. You did it. Congratulations. You have officially made it through all 4 tiers, the entire top 200 drugs. By going through this tier by tier, you've done more than just memorize a list. You've built a real understanding. And that's the kind of deep knowledge that's going to make you feel so much more confident on exam day and in the pharmacy. So, what's next? To keep the momentum going, make sure you check the description below. We've got links to flashcards and tons of other resources for you. And if this series helped you out, do me a favor and hit that like button. And definitely subscribe so you don't miss out on more stuff to help you ace the PTCE. And hey, if you have questions, drop them in the comments. Listen, you put in the hard work, you've been disciplined, you put in the effort, and it's going to pay off. Go into that exam with confidence because your certification is right there, waiting for you. And before you go, tell me in the comments, what's the #1 thing you want us to cover next to help you pass? Thanks so much for being here.